This is the Operation Immunization Vaccine Administration Protocol. By the end of this video, you should be familiar with the immunization process employed during UOP health fairs by our committee. Let's start with the screening. After a patient has indicated that they would like a vaccine, you need to first complete the top portion of the screening form. It is important that you fill out the information for the patient so that the handwriting is legible, the information is recorded in the appropriate area, and that the information is correct. If this is a Medicare event, it is imperative that you record the patient's Social Security and Medicare information in the box located on the top right-hand side of the vaccine administration form. It is also imperative that you record the 3 or 4-digit Medicare passport number that the patient receives upon registration for the health fair in the indicated area. After you gather all this information, you will screen the patient by completing the backside of the form. Before screening the patient, write your name and initials at the top of the screening form. Go over what each question means and why we ask each one. If the patient is eligible for the vaccine after the screening questions have been completed, have the patient wait until an immunizer is ready to administer the vaccine. At events where billing is taking place, this is a good time to give their information to a preceptor to bill their insurance for the vaccine. In some circumstances, the patient may have a copay or may wish to pay cash for a vaccine if they do not have insurance. Make sure the patient is willing to pay for their vaccine before administering the vaccine to the patient. Once the patient has paid for the vaccine, the syringe can be prepared. At the scene, you will have gloves, a vaccine vial, an alcohol swab, and a syringe. First, put your gloves on. Then, open up the protective cap of the vaccine vial. Open up the alcohol pad. Swab the top of the vaccine vial once with an alcohol pad. Do not swipe a second time. Wait for it to dry. Do not fan, and do not blow. Open up the syringe. Prepare to inject 0.5 milliliters of air into the vaccine vial. Indicate the bevel side of the syringe. It is the side that is opened up. Insert the syringe bevel side up into the vaccine vial. Inject the air. Pull out more than 0.5 milliliters of vaccine out. Flick to get rid of any bubbles. Once you are satisfied, you'll need to ensure that only 0.5 milliliters of vaccine are actually inside the syringe. Recap the syringe. Bring it to the immunizer. Once the patient has sat down at the immunization station, make sure to verify the patient's first name, last name, and the vaccines they will be receiving. Double-check the screening questionnaire for any red flags and verify allergies with the patient. Inquire about which arm the patient would like to receive the vaccination. Make sure you have all of these items before beginning the injection procedure. Trash can, cotton balls, Band-Aids, alcohol swabs, a sharps container, gloves, and an emergency kit. First, expose the patient's shoulder. If necessary, ask the patient to hold their sleeve away from the injection site. Clean the deltoid with an alcohol swab in a circular motion starting from the center of the circle and moving outwards. Let it dry for a few seconds. Do not blow or fan. You can prepare your bandage and get the syringe ready while waiting for the alcohol to dry. Locate the injection site on the deltoid by creating a C with your hand, 2 finger widths below the shoulder bone. Support the patient at all times with at least one hand. Inject the vaccine in one swift, smooth motion. Activate the safety feature. Dispose of the syringe in the sharps container. Do not put your hands in the sharps container. Discard your gloves and wash your hands. After completing the vaccination, remember to sign and date the form in the appropriate area. Also have your preceptor sign and date underneath the signature. During this process, the patient must be offered a VIS form for the vaccine they receive. Here is an example of a VIS form. If the patient begins to bleed, calmly stop the blood flow by applying firm pressure to the wound with a cotton ball. Apply an adhesive bandage to the injection site. Ask the patient to wait in a room for 15 minutes after the injection. They should be instructed that once 15 minutes have passed, they may leave on their own.